Pop star Olivia Rodrigo is expanding access to what she calls reproductive health care. The singer invited the organization Right By You to distribute free emergency contraceptives, condoms, and information on abortion to fans on her Guts tour, according to Variety.
Concert attendees at her St. Louis show on March 12th were able to take a package that included Julie, an emergency contraceptive, and cards with QR codes that link to abortion access resources, as well as the Missouri Abortion Fund. Fans also say free condoms were passed out.
What do you think about this? Olivia Rodrigo, here's my problem. I'll start.
Other than the fact that she can't sing, but that's my problem.
She does not have good breast support. Thank you for saying that. But I will say she has a very young fan base, and I think it's fairly irresponsible for her to provide these things with really not much guidance on when or how you're supposed to take them. I mean, emergency contraceptives don't come without risks and side effects. And when you're having people who are 13, 14, 15 years old come to your show, and you're kind of giving them this idea that they should perhaps engage in promiscuous, risky sex to the point that they have to take an emergency contraceptive or get an abortion, I don't think that's a very empowering message for her to be sending to her young fans.
So, all of her fans, she does have a younger fan base. I think that some of them are teenagers, but we also have people in their 20s who are also fans of Olivia Rodrigo. I'm outside of the group of people who would care about it. However, I do believe that this is no different than schools that offer contraceptive products. And we've seen that pop up across the country. It's always been controversial. However, I think that for individuals who are going to be active, you're not going to give someone condoms or talk about birth control or birth control access, and somebody who's not engaging in sex already all of a sudden decide, you know what, now that I have a condom, let me go and try it. That's not what's happening. It is, I think, smart to talk to people about what their options are to ensure that they don't have, unplanned pregnancies, to help prevent those types of things, but to also be honest about the fact that a lot of young people are having sex. I don't think that there's some rebuking that we can do to stop people from doing that. But I do believe that there is amongst young pop stars, and we've seen it time and again. I was of the era when Britney Spears, before she kind of went a little wackadoo, was out here doing her thing, and people held up her virginity as this huge thing that we should all follow, and they pressed her in interviews about it, as they did Christina and other people of the time, and it was very uncomfortable to watch. I think that when we have young people who are, charged with all these images they see in front of them, whether it's, on TikTok and some of the things they probably shouldn't be seeing on TikTok, and they are, living their lives, be it whether they're college students or what have you, it is important that they also know that there are risks here when it comes to sexual activity, that we're not only preventing pregnancy with condoms, we're also preventing the outgrowth of STDs. And we know that several of them, in particular states across the country, are developing in ways that are resistant to drugs. We have to be able to talk to people about why they need to protect themselves. And unfortunately, there are young girls who will be victims of incest, who will be victims of rape, who will be victims of abuses that happen on college campuses, who do need to access a certain level of care, be it whether that is emergency contraception or be it whether that is an abortion. I don't think that we can get away from that conversation. And I think that Olivia Rodrigo, she knew that there were going to be some hits taken. It's a controversial topic, but she was willing to take that. And I don't like her music, but I think that what she's done here is actually taking a stance at a time where, women's reproductive rights are one of the major policy conversations in this election cycle. She's taken a stance to also make it matter on her tour.
Yeah, I guess I would feel differently if it were just literature, but actually handing out the emergency contraceptive when you do have young women there who might not be escorted by parents. It strikes me as a bit concerning. And then the abortion side of it as well. I mean, having that come from a pop star with your young fan base, I find it irresponsible. But you brought up the fact that these reproductive health conversations are coming up in the political sphere. Vice President Kamala Harris, for example, made history yesterday. She visited Planned Parenthood in Minnesota, which is believed to be the first time a president or vice president has visited an abortion clinic, according to the New York Times. This is part of Harris's, quote, Fight for Reproductive Freedoms tour.
Here's what the vice president told reporters during her visit to the clinic.
Many of you have asked, why am I here at this facility in particular? And I will tell you, it is because right now in our country we are facing a very serious health crisis. Part of this healthcare crisis is the clinics like this that have had to shut down. And what that has meant to leave no options with any reasonable geographic area for so many women who need this essential care.
I thought that thought it was very smart. Reproductive rights, women's reproductive rights are one of the top policy issues in this campaign cycle, one of the top policy issues we've seen in special elections, we've seen in the midterms. It has galvanized women of both sides of the aisle, of multiple demographics. Women want to have the right to choose. But I think that this is a very important conversation, particularly because she visited a Planned Parenthood clinic and it's not reported as, she is the first sitting vice president to do so. She is the first person from, White House leadership who has ever done so in history. That's a very important message to signal. One, because I think that, and we didn't include it in that cut of the speech that was just presented, but less than 3% of Planned Parenthood's activity is abortion. The overwhelming majority of what Planned Parenthood does is well woman screenings. As someone who has fibroids, which are literally tumors that grow in your uterus, Black women tend to have them at earlier ages and more aggressive than anybody else in the population. The identification came from a Planned Parenthood clinic. Understanding that for many of us who may attend colleges outside of our hometown and who may not have health insurance, I didn't have health insurance when I was in college. The Planned Parenthood clinic was where I went to get my well woman care every year. Those annual exams that help to determine whether you're at risk for cervical cancer, exams that up to and including, mammograms and other things like that. This is extremely important health care for women. And I think that it's important that when we have this discussion and we talk about centers like Planned Parenthood, it is not only housed in the abortion rights conversation, it is also housed in women's health care, because women's health care and health care access at free or low cost is a significant part of what Planned Parenthood does.
I just think it's inescapable that Planned Parenthood is about abortion, though, because according to the Guttmacher Institute, it's actually 75% of their services are related to abortion, even if it's just referrals. And a vast majority of their profit comes from abortion services as well. And there's way more crisis pregnancy centers and other women health centers around the country than there are Planned Parenthood. So if you're talking about access to those services, like well woman exams, mammograms, which Planned Parenthood says they actually don't perform, then there's a lot of places for women to access that care. It doesn't have to be at a Planned Parenthood. And I think it's disturbing that all of these years later, we're still providing federal funding to Planned Parenthood while we don't give it to other women's health clinics, because what we know is that money is fungible. We claim that because we're not directly funding abortions through Planned Parenthood, that somehow that doesn't violate the Hyde Amendment, when Planned Parenthood is freeing up other funds in order to provide abortion services. So we might not directly be paying for abortions, but we are indirectly with our taxpayers propping up this organization that does make most of its money from providing abortions.
So as somebody who, and full disclosure to everybody, who's watching, I've sat on the Planned Parenthood board for the state of Illinois. And there are some ways that you're playing fast and loose with facts here. Again, less than 3% of the services provided by Planned Parenthood are abortion. What they do, and what a lot of women come in for, is emergency contraception. It is ensuring that they can get the birth control pill and birth control access. And in many cases, again, depending on where you live, I went to high school in the great state of Mississippi. Depending on where you live, you may not have that level of access in your community, or the rolls are so long. If you're a Medicaid recipient, for instance, somebody who's at or below the poverty line, so you're getting government assistance for your health care, to get an appointment in many of those clinics and many of those doctors' offices can take months. If you're a woman who is at risk for cervical cancer, if you're a woman who needs that well woman care, you could be in a much more detrimental position waiting 6, 7, 8, 9 months later, because the rolls are so long of women who have this need. Whereas a Planned Parenthood clinic can get you in within a week, sometimes within less than a couple of days, to have that well woman care exam. These are very important things. And I think that, again, for this conversation, we have to remember that there are women who are in dire straits outside of abortion care and abortion services who are utilizing these resources as their go-to because they cannot get into a doctor's office.
That just seems unlikely to me, considering there are so many more crisis pregnancy centers and well women's clinics outside of Planned Parenthood. I think the number is about 3,000.
And again, the rosters are extremely long.
But why would they be longer at the places where there's more of them?
Because it depends on your insurance and insurance access. The rosters are longer if you do not have, your Cadillac level of insurance. You can get in a whole lot sooner if you have great insurance than you do if you are a woman in poverty or a woman who is working a job to where she does not have health insurance provided for her. Those people consistently have a hard time getting into these healthcare clinics, and that is a large portion of the American population. There are a lot of women who, quite frankly, do not have Blue Cross Blue Shield, who do not have Cigna, who do not have Aetna, who need to get their well woman care. And for those individuals, there are very few options for them to go to.
I just fundamentally disagree because crisis pregnancy centers, most of them are for uninsured and underinsured women. They do provide a lot of services for free. It's not just Planned Parenthood that provides that. And yet there's so many more. There's tens of thousands of crisis pregnancy centers around the country and only about 3,000 Planned Parenthoods. So I think when we act like Planned Parenthood is the only place women can go, that it's not really an honest conversation, to be frank with you.
Again, it depends on where you live, what level of access you have. And because there are a lot of Republicans who are pushing to upend these services entirely, even the clinics that you're mentioning right now stand the risk of being shut down. And we've seen that happen in cities across the country.
Yeah, I'd like some data on whether crisis pregnancy centers are being shut down, but I know we have to leave it there. That's actually going to do it for us today on Rising. Ameshia, thank you so much for joining me at the desk today. It was a really, really great time.
Absolutely. Glad to be here as always.
We'll have you back soon. All right. For those of you who like to be sure to like, share, and subscribe so you never miss any content. And for those of you who like to listen while on the go, we are now available anywhere you listen to podcasts. See you next time.